Welcome to Physiotherapy Chats, a Singapore Physiotherapy Association podcast.
So welcome everyone to our Physio Chats. So I'm Angel, Physiotherapist. I'm represent SPA to host today's podcast session. So I'm working in NTUC Health and seeing Moderator and neuro patient. So today I'm very happy to have our Prof. Teo over here to share his knowledge and recent research finding regarding resistance training and our brain health. So let's welcome Dr. Teo. So Dr. Teo, very welcome. And Dr. Teo is our neuroscientist, sports scientist, and also a professor from NIE. So I would like you to introduce yourself. Let us know about you more.
All right, thank you very much, Angel. And thank you very much to the Singapore Physiotherapy Association for having me for this podcast. It's definitely my honor to be speaking to all of you, I think it's just the both of us, but I guess you get the point. So my name is Teo Wei Peng. I am a neuroscientist, but my bachelor training is in sports science. And I've always been really keen on the effects of resistance training, just in general, right? So I started off doing a lot of resistance training, doing a lot of strength training. And I had the opportunity in my PhD to look at how exercise can impact certain clinical populations. And I was lucky enough to actually be under the mentorship of a few neurologists back in Western Australia. So I graduated from the University of Western Australia. That's where I got my PhD. And I guess over the years, I've sort of developed this area of interest or research interest, whereby I was looking at mechanisms that would underpin exercise with regards to the brain. And specifically, I wanted to know, are there any sort of differences that are between aerobic exercise and resistance exercise, considering that both these forms of exercises are the most prevalent, right? Mm-hmm. And of course, different things like, how different exercise intensities, different duration, and all these other factors would play a part in shaping or changing the way our brain behaves. So that's kind of my research background in a nutshell.
Okay, thank you for sharing. I think now recently we have publicity of the system review, right? You want to share about this? I mean, like, what is the background and like what's the topic as well?
Yeah. So as you have mentioned before, I think there are a lot of studies highlighting the beneficial effects of exercise on brain function. And I think all of us will agree unanimously that we should be performing exercise daily in order to prevent, a lot of situations whereby, or unwanted situations from happening to our bodies, right? Physical bodies. Mm-hmm. But I think apart from that as well, I think there's a growing amount of literature that sort of suggests that exercise, whether it's aerobic or resistance or different forms of exercise, can have beneficial effects on brain function as well. Okay. And I think one of the take-home messages that I would like to sort of bring home, particularly to this in this podcast or this chat, is that we really should not be looking at the physical body and the brain as two separate entities, right? I mean, I guess in medicine or in allied health, we have different specialties that divide all of us.
Correct.
And it's the same in research as well. We have a neuroscientist, we have a musculoskeletal research specialist, and all these sort of things. But I mean, essentially, the body, the brain relies on the body to do things, and the body relies on the brain to move, right? And to perform different actions. So yeah, we really shouldn't be separating those two systems. Yes. From one from another. So I mean the publication that I've published essentially is to sort of shed a bit more light and create a bit more awareness about the use of resistance training, particularly in geriatric populations. I think a lot of times we often assume that older adults should not be performing resistance exercise, or they're more resistant to resistance exercise. But that really isn't, but that really shouldn't be the case, because we know for a fact that as we grow older, we encounter muscle loss, loss in bone mass as well. And we would use resistance training to try to attenuate those loss anyways. But we also know that by moving our musculoskeletal system or enhancing that system would also have some upstream effects on brain function as well. So that's why myself and my team, we put together this review just to create a bit more awareness of, there's not just aerobic exercise that improves brain function, but there are also other forms of exercise that would be just as good to improve brain health.
Yeah, thank you so much. I understand because I'm seeing Jerry population, like certain time there is a resistance for them, perform resistance training. I can totally understand that. And I think you bring out a very good point that we cannot separate like the body and the cognition and also the brain path. I think that is really like one person and whole body. So we need to look into it. So I know being physically active is essential for us to maintain of our personal physical, cognitive, and psychological well-being. So we like to share what is the relationship between physical exercise and the brain health for our adult or for our senior.
Yeah. So I think there are several mechanisms that would underpin this relationship. Typically, when we look at the exercise science literature, we would sort of separate the acute effects or short-term effects. So maybe if you do like 1 or 2 bouts of exercise and what happens to brain function and cognition, versus the more longer-term chronic effects. So meaning to say that if you are performing exercise for months and years, what sort of mechanistic change happened with that prolonged period of exercise, right? So I think by and large, in general, what we find is that the acute effects, and this is typically for any adults or anybody that's doing exercise or resistance training in general, is that we get this increase in cerebral blood flow, which is obviously important. Because obviously when we exercise, we increase blood pressure. So that obviously sends more blood up to the brain. And of course, increase in body temperature as well, which has a sort of a cascading effect of releasing of different type of hormones at in a very short period of time. So in that sense, we do actually get benefits or immediate benefits just by even a single bout of exercise. Of course, there are sort of conflicting literature as to, if you do like a high intensity versus a low intensity. But I think in general, what you will find is that by just performing 1 or 2 bouts of exercise at a moderate, maybe even to a high intensity, after a while, what you do actually see is an improvement in cognitive outcomes, even potentially some of the more psychological mood outcomes as well. For longer term effects, what we do see is that we do observe chronic changes in certain factors that are in the brain. So for example, brain-derived neurotropic factors, which help with neurogenesis. And there are other factors that I've stated in the article as well. So things like insulin-like growth factor 1, BDNF is obviously the other one. So all these different proteins are sort of upregulated as we perform exercise, especially on a chronic basis as well, which would obviously help to underpin some of the changes that we observe. I guess the other aspect that maybe it's not so much discussed within the exercise literature is that exercise is a very social thing, right? So as we exercise, we would often exercise in pairs or in groups, right? So that social interaction plays a huge role, in fact, which I think a lot of people sort of downplay a lot of times, right? If, for example, if you exercise with a good friend or if you exercise with a partner, it is likely that you are probably going to be a bit more motivated, and therefore you are going to be working at a higher capacity. And of course, we also know that social interaction is important when it comes to improving your mood outcomes, your brain functioning outcomes as well, right? So again, I think it really drives home the point that especially in a geriatric population, when this social interaction and the exercise, or the combination of these both different factors, will be essential for them to reap those benefits at a cognitive level and even at the mechanistic brain level.
I see. Yeah, I think you bring out a few points in like acute effect and long-term effect, but this all is just a physical exercise, right?
Yes.
It's not, yeah, okay. So I think the social things is very important. The peer support and peers pressure. I mean, they will have some pressure and they will do the exercise, physical exercise, to keep them active and keep them sustain as well. I think the sustainability without the program or exercise program, how they sustain to continue have a physical exercise. I think that also is important to understand as well, right?
Yeah.
Yeah. So I think you brought up those physical exercise benefits, and we know there is aerobic research. A lot of research regarding the aerobic exercise is helping improving the cognitive health. And like, for example, some factors that you bring in the BDNF, IGF-1 and VEGF. So how about the resistance training? So is it any different mechanism compared to the aerobic exercise?
Yep.
Yeah.
Yes, so it does seem that both types of exercises function different from a mechanistic point of view. I mean, overall, there are studies that also sort of show that with resistance exercise, you do have this upregulation of the different neurotropic factors such as BDNF, IGF-1, VEGF. But what we think is that if you look at resistance exercise, and if you look at the different types of resistance exercise, there is actually a high level or a large component of coordination or body coordination. Let's say if you do a squat, right?
Yeah.
It's a very simple motion for adults, young adults like us, for you and me. I'm not very young anymore, but I still consider that.
Still young.
But for an older adult, a squat, just a simple or a sit to stand, right, requires a lot of balance. It requires a lot of coordination, both in the left and right limb. And it requires a lot of postural control, right? So when you look at resistance exercise, you're really enacting quite a large amount of attentional demand to balance your body, to make sure that you produce the movement that is very smooth and you're not, having a very bad form when you're doing this resistance exercise. In fact, it is a well-known fact that when you first start resistance exercise, the improvements that you see are not because that your muscles are getting bigger. I mean, but it's because you are coordinating your limbs a lot better. Right? So there's a large neural component that underpins resistance training that we don't really see with aerobic exercise, because aerobic exercise, generally you're doing something that's very continuous, right? So it can
like
become
jogging, walking, those you already know and usually you are doing, right?
Exactly.
Okay.
Exactly. And at least with resistance training, you are actually increasing the effort by having a load on you as well. So for example, if you're doing a squat, you have a bar in your back that you have to balance, right? So you have to sort of coordinate your left and right side of your body at once. And then you have to sort of think about your form. You have to think about all these different things. So there's a lot of attention that is being allocated just to perform that one single repetition. And it's that continuous having to think about where your body is, how your body is moving, that we think is driving some of these changes, especially at a very acute stage of this exercise. I mean, of course, you will get better once you've learned that particular skill. And I guess this is where you can then introduce more novel type of activities, you might want to do like a single leg.
Sit to stand, single leg squat.
Yeah, exactly.
Okay, so does it mean because at resistance training there is different form? For example, we can use machine like just sitting, knee extension, then you adjust a lot, and like other form will be use our body weight. For example, sit to stand, but you increase the load eventually. So which is more recommended for the cognitive health? Like for example, you say sit to stand, to move your different part, then you need not familiar with the movement. Does it challenging them more? Then will help the cognitive functional part better.
I think it's very much dependent on your how you progressively overload the system, right? So I think if you want to see any sort of improvement, you have to challenge the system. But we cannot, just all of a sudden push them so drastically at a very fast pace, right? You have to progressively increase the difficulty level. So I don't think there's any right or wrong scenario whereby which is better. I think both using machines definitely have their own benefits. Using your free weight or using body weights have their own benefits as well. So maybe it could be the fact that we, for an older person, maybe if you want to build sort of strength, we might want to use machines so that they can get used to the weights, get used to the pressure, and then progressively transition them from
more functional
machine to more functional.
And
then potentially even have maybe start to include instability to their movement as well. So using a wobble board or foam platform so that the base of support becomes uneven or unstable.
Or using TRX also.
Yeah, exactly. Yeah, exactly. Correct. So there's no real right or wrong answer to this. I think as long as
that's how you plan and how you progress.
Correct.
And like for the safety first, you want to build up certain things, you can use mechanism and machine first. And after that, you should like continue to use other like functional tasks or functional movement.
Yep.
Yeah. Okay. Thank you for sharing. So any other mechanism like compared to aerobic, like what you share regarding this? Any add-on thoughts?
I do think that in regards to why these changes occur between aerobic and resistance training, I think that's something that we need to do a bit more investigation. I think there's still quite a lot of things that we don't really understand very well with regards to, I guess, some of the effects of exercise especially on brain function. But what I would suggest is that to sort of maximize the effects of exercise is to actually have a combination of both. You kind of want to have both aerobic, you want to improve or maintain your aerobic fitness as well as your strength, neuromuscular fitness as well. So it's very cliche to say that we have to do all these different exercises, but it is true. I guess the important thing is that you want to try to, I guess one important aspect is that try to make it novel and try to make it fun for you, right? So it's you don't want to be exercising and really dreading to go to exercise or feel like going for exercise, right? The point of exercising is so that you have the element of novelty and element of enjoyment and excitement, so therefore the whole social aspect of exercise therefore then sort of comes into play.
Yeah, because when you do exercise already very tough, very tired, so make it fun and work them hard without them knowing as well.
Correct. Exactly.
Okay, so how resistance training parameters influence our cognitive function?
Yeah. So I think this is something that we have that we wanted to create a bit more awareness with the paper. At the moment, there are not many studies that directly compare the different parameters of exercise or resistance training specifically, and how that impacts on cognitive functioning. I think the strongest evidence is is predominantly lying or pointing towards the effects of intensity on brain function, right? So typically what we want is that we want to be performing at least some sort of at a moderate intensity, whether you use heart rate or use some sort of rating scale to measure the intensity. I think as long as they are sort of in the moderate to high range, I think that has the most evidence so far to show that it does benefit cognitive health. The different types, duration of exercise, I think that the evidence is not so well established yet. I mean, when you look at resistance exercise, is there any point in doing like a 2-hour gym session versus a 1-hour gym session? I mean, I'm not sure lah. But I guess from a logistics point of view, 2 hours is quite a long session.
Yeah,
right? And
correct.
I don't know
It's like 2 hours.
yeah, exactly. So would doing it in a shorter amount of time, but maybe increasing the intensity be a lot better, right? So again, there is a lot of considerations that you have to think about in a realistic sense. I mean, in research, we can control for this and that, but in reality, maybe not everybody has got 2 hours to spare in the gym.
Yes, and I think people will tend to like short and sweet. I'm so busy and I didn't want me to like struggle for so long. I think in the future, if there is like, okay, very fast one, then you have seen the effectiveness of the strengthening exercise, resistant exercise, then I think a lot of people will be more willing to do exercise, I think.
Yeah. And I think it sort of highlights the, I think nowadays, a lot of people talk about HIIT training or high intensity training, right? I mean, there is definitely evidence to suggest that that is quite beneficial. But like I said, I think, because the evidence is not, or at least in terms of brain health, is not really that well established. And it's, I think only the last 10 years that we start to see more papers being published in this field. But I do suspect that if you can put in a short, sharp session that is at a moderate to high intensity, anywhere from, let's say, 20 minutes to half an hour, just go in there, do the exercises and come out. I mean, personally, what I do believe is that you might be able to have very similar benefits as you doing a 1 hour, 1.5 hour session, but then you sort of in between, you have very long breaks, and then you sort of walk around and then
talking.
Yeah.
Understand. Yes. Yeah. So I think it's very good time like having a discussion with you and having a lecture, like evening lecture with you, like one-on-one. I mean, so lucky to have this opportunity. So any last any thought you want to share regarding like resistance training?
I guess for me, I'm always an advocate for strength training or resistance training in any sort of population, right? A lot of people always tell me that, having good cardiorespiratory health will have all these benefits. Yep, yes, I agree. I definitely, I will not deny that, having good cardiorespiratory health is important, but having a good base strength or good base neuromuscular functioning allows you to go about your daily activities. So things like getting out of bed, getting off a chair, just doing your housework or even walking as well. You require a certain amount of strength to do it, especially for those that work with geriatric populations as well. We often see a high incidence of falls, hips fractures, and all these kind of things, right? So in order for older adults, or at least to recover from a fall, so meaning to say that if a person were to almost fall but then they recover, they need a lot of strength and power for that.
Recovering from the near fall, right?
Exactly, correct. Yeah. So if someone is lacking in strength and power, then the incidence of falls or from near falls to a full fall would be a lot higher. So essentially, what I'm sort of advocating for is that in populations such as neurological populations, such as I guess things like Parkinson's disease, Alzheimer's disease, or dementia, that those populations, all the more they should be strength training a lot more. And of course, in the general older adult population, even though a person might seemingly be healthy, having 1 or 2 strength training sessions in a week will definitely benefit their neuromuscular health.
Yeah. I think not only for the dairy population, so they need to overcome the near fall. Then, like what you say, you need to have a fast twitch muscle power, then to react to prevent the fall. I think like that you brought out the importance of the resistance training, not only make them stronger, and also the cognitive health as well. I think this is a new take-home message for me. So usually when I do exercise with my Akong Ama, right? So I'm thinking I'm stronger. Make them stronger, strengthen them to have more muscle power, muscle strength. But I didn't. At this point, like me, they will help with their cognitive and their brain health as well.
Yeah.
And
I think maybe just to add one more point as well, which I almost forgot, would be that in resistance training, I think it provides you with an avenue to get them to, I guess, engage with in sort of a dual task environment, right? So, for example, you can get them to do certain exercises, but get them to also maybe do something else, like counting backwards or calculate, or I've actually seen one where they were holding a tray with like cups of water on that tray. Okay. So they have to balance, and then they have to do all these sort of counting.
Step up and down the stairs.
Yeah, yes, correct. So it's very functional. These are very functional type of activities that you can employ, and you can do it almost anywhere, right? Like
correct.
You already have steps there. You can use, of course, the safety aspect you have to look after a little bit, but I think by and large, these are very functional type of movements that you would employ in everyday living anyways.
I think this will make them easier to exercise in their home environment. Yeah. Thank you. So last question. So what resistance training you are doing for yourself?
Well, for me, I'm as I've mentioned earlier on, like I sort of tend to like to do the short and sharp type of exercises. Go to the gym. We are very fortunate here that within the department we have a weights training room. So I guess for me it is very simple. I think I tend to focus a lot on large movements, so things like your squats, your deadlifts. Very old school powerlifting type of
powerlifting. So make sure you can carry someone, right?
Yeah, well, I don't know about that. I don't know about carrying someone, but I think I sort of use it to sort of break up my sitting time a lot. Like obviously I spend a lot of time in front of a computer, or sometimes I spend a lot of time in class with students as well. So there's a lot of physical inactivity. So for me, it's a good way to sort of get my heart rate up. And and we've got our resources here, so it's for me to do lah.
I think it's a very good model and example that when we ask people to do exercise, then we ourselves need to be a role model.
Yes.
I think yes, you give us a very good example, like ourselves doing exercise, then we can be ask them to do as well, ask our senior to do. And I think another thing is when ourselves doing exercise, we know the struggle, and the difficulty and or the soreness of the muscle afterwards. So I am enjoying that, but sometimes it's like really not feeling so good. So we can understand how difficult our dairy population will going through, and if they are very willing to continue, I think we need to encourage them more.
I'm definitely very hopeful to see more older adults engaging with resistance type of activities. I think there's a common misconception that resistance exercise can only be done in the gym. You can definitely do resistance exercise outdoors, at home, with very simple implements. In fact, even by just like you say, walking upstairs is a form of resistance exercise, right? I mean, you're doing, you require a lot of muscle strength in that. So I hope that there will be more, I guess, programs or opportunities for older adults to be resistance trained or be resistance training. And I'm also hoping that, there will be, of course, champions for this as well. I mean, I do see nowadays, especially with the Sports SG gyms, that allocated time for older adults to go in, which is, I think, is a positive thing.
And I think 60 years old and above is free.
Yeah, so I definitely would encourage more older adults to go and engage with strength training or resistance training.
So for my point as a therapist, right? So I think as a therapist, we need to be creative and help them to keep themselves active. And I think we cannot be the one to limit them. So sometimes we'll think, already not too difficult. Right. I think we should not be their limitation. We cannot be their barriers. I have like 80 years old Ama can do plank with me. Or even can squat up and down on the Bosu ball. So I think they always prove that they are able to do. Sometimes it's our own mindset to stop.
Correct.
I think we should like change and like really be safe, of course. But I think we need to be the one, not encourage them to do exercise and not be the one to limit them. I think that is very important, as a therapist.
Yeah, I definitely agree with you. I think especially within Asia, we have a certain mindset about
gassy culture.
I think our mindset of aging is very different from, let's say, compared to Australia or the UK or in the US, right? So I think if we can start to change some of this mindset for them to be a bit more adventurous and venture into to do all these different exercises, and I think it will happen.
Yes, I believe.
It's just maybe we have to do, like you said, we can't be barriers ourselves. We have to encourage them to do more.
Yeah. Yes, thank you for sharing. I think we have a same direction.
That's good.
Thank you so much, and thank you so much for your Friday night time, sharing with us. I think hopefully we have more collaboration with SPA together with your team.
Of course.
No, so I think if anyone have any question, I think you can comment down. Then we can like bring it up to Prof Teo, or SPA will try to respond as well.
And I guess if there's anyone out there who is keen on a research project or do any sort of research in this area, more than happy for you to contact us or contact me if you want. One of my grad students is actually a member of the SPA as well, Ma Shinin. So she is doing she's doing some research work with me as well. So more than happy for anyone to be collaborating.
Okay, so I think you can share the contact. Then anyone inquire, we can like link them up with you.
Sure.
Yeah. Thank you so much for today's sharing.
Thank you very much, Angel.
Thank you, everyone.
You have been listening to Physio Chats, a podcast series brought to you by the Singapore Physiotherapy Association. Follow us on Spotify and our YouTube channel for future content. We'll see you then.